Hi, I'm Rashanah Baldwin, a journalist, a Chicagoan, and a millennial bringing light to everyday stories that matter. I share the type of stories that mainstream media ignores or gets wrong. The news of the neighborhoods, the news that matters. Here is someone you need to know. So, Georgette Brown, thank you for joining me during these times amidst COVID-19. You are an RN that focuses specifically on women's health in the Oaklawn area, which is a suburb of Chicago. How are you doing? What is the morale like specifically in your field?
Well, right now at the current moment, patients are scared. Medical staff are scared as well. So we just try to stay as strong as possible, stay positive, optimistic as well. So what we're doing is we're doing precautions. So no patient is allowed to come into the office as of right now and just sit in the waiting area. So we have a new system where a patient will call from their car once they're in the parking lot. The receptionist would get their phone number, check them in from the phone, and then at that point, that's when one of the nurses or medical assistants, when we're ready for them, we will call them. We have them meet us at the door. At that point, that's when we're doing COVID-19 assessment. So we're asking all patients, it's a quick survey. So, have you been hospitalized recently? Have you had any fever greater than 100.4, a temperature greater than 100.4? Have you had any symptoms such as cough, shortness of breath? Have you been exposed to anyone who's tested positive for COVID-19 in the last 14 days? Have you traveled to any geographical area that's highly impacted by COVID-19? Once they say no to all these questions, then we take their temperature. At that point, then they can proceed into the office, the practice.
How close are you all getting with the patients, and the appointments that you are taking? Are those, what type of appointments are those?
So every patient, of course, is required from Oaklawn to have a mask or some type of face covering to even enter the building. We're taking all OB patients, of course. We can't turn down our OB patients. We're taking non-emergent gynae patients. Non-emergent gynae patients are actually being given telehealth appointments. Where they actually do a web appointment with the provider. But however, if it's an emergent gynae, then they would have to come in because they have to be examined by a provider. But we're slowly starting to see in the last 2 weeks more and more gynae patients being put on the schedule. Because there's only so much that you can do on telehealth. You know what I mean? You actually need to physically see the patient and examine them. So,
is these issues related to pregnancy or just overall, maybe specifically women related issues, or is it more so maternal?
Well, we can't turn down any OB maternal patients. So any patient who is pregnant, they have to come into the office. Okay. Some of these patients, however, it's only so much that we can do in the office for them if it's an emergency situation. If the patient before COVID-19, if they were less than 14 weeks pregnant and they had an emergent situation, they would have to go to the emergency room because they didn't qualify to go to an OB unit. But as of now, all our OB patients, even if you're only 5 weeks pregnant, newly pregnant, we would send you to OB triage. They're bypassing the ER just because it's so prevalent, so many positive COVID-19 patients in our neighboring hospital, which is Christ. So we try to just keep them away from that. A lot of patients are very scared. We have a lot of 6-week postpartum patients who are coming just to be checked and examined after they've delivered, and a lot of them are postponing these appointments because they're just scared to come into the office and just be exposed. We're not allowing any patients to bring in anyone with them with these visits. So no significant others, no children, just the patients. And that's the protocol too when they go into the hospital with OB triage. They're there alone. So it's very scary for them. And I know during the delivery, patients are only able to have one person with them in the delivery room. Patients are also tested for COVID-19 before delivery. So either if they're in labor or if they're planned C-section, they would have to have COVID-19 testing prior to delivery. And if they are positive before delivery, once they deliver the baby, they'll be separated from the baby. The baby will be put in the NICU.
Wow. And you know what? I saw on ABC National News that a mom just got reunited because she tested positive for COVID. She had just got reunited maybe 3 weeks later with her daughter. That's the new normal essentially, huh?
Yeah, it is. And I've came from a fertility background before this OBGYN office. So we also have patients who are in the process, of doing planned monitor cycles, so patients who have a hard time getting pregnant the natural way. So we give them medications to help with the ovulation process. So some patients still want to move forward with this, but many have put this on hold because of, what's going on, because really no one knows how it affects the fetus inside the uterus. We don't really know that. So yeah, patients are really being encouraged by the physician to, postpone getting pregnant if they can.
How are you, when you all treat the patients who are coming in, are you all completely suited? React to that.
We're a small practice, so since all of this been going on, we have not been able to get any N95 masks. We don't qualify for that. So all we have are the standard surgical masks. And pretty much we had an abundance of surgical masks in our supply room before COVID-19. As of now, they're only allowing us to order 2 packs at one time for the facility. So it's very short. And so we're in the situation where medical staff, we have to use a surgical mask for the whole week, one mask, which normally is against, protocols. And then also, when we're also wearing the cloth covering mask that,
On top of the surgical mask.
Yes. We don't have, we're not required to wear any gowns or anything, even though we have them in the office. So we try to practice social distancing with the 6 feet distancing, but sometimes it's hard when you're dealing with patients. So just making sure we keep our hand hygiene, sanitizer, washing our hands, going into and coming out of patients' rooms, wiping down the nursing stations with our Cavicide wipes.
Are you all still doing the procedural normal routine appointments that includes, pap smears?
Yeah. So pap smears is a non-emergent gyne.
Okay.
So we're postponing those out. Initially, when all this happened, we was pushing them to the end of May. Now the end of May is approaching, so now we're pushing that till the end of June. So it's kind of like a week by week basis because it's not really emergent. However, we do still have surgeries on schedule. So if you have polyps, or you need a hysteroscopy, we're doing DNCs. We're still doing those procedures. So we do them twice a month. We'll have several next Thursday. The new process as of this week coming up with the new surgeries, this will be the first time we've done any surgery since we've been, impacted by COVID-19. So starting Monday, we'll be testing these patients who are scheduled for Thursday surgeries actually for COVID-19. So they'll come
So
in.
if those patients have COVID, then what happens?
We more than likely probably won't treat them because, like I said, even though these surgeries, they're needed for the patient, but they're not life-threatening where if they don't get this procedure that they're going to lose their life. So they can just be postponed to a later date. Yeah. So we're a smaller facility, so we have COVID-19 testing kits. We get our results much faster than some of the testing sites because they have such a large volume of patients coming in. So we can get ours within like 48 hours. So we've tested some of our staff, so it's actually faster.
how are you feeling? What's the morale like in your office? And yeah, how are you feeling? How are you adjusting, especially being a mom and a wife? I hear your daughter in the background a little bit. How is life for you?
I think just like I said, just trying to stay positive. Of course, it's in the back of your head. You don't want to take this home to your family, you know. But just like I said, practicing, keeping my mask on, keeping my hands clean, keeping my workstation clean, just educating the patients, because they can have a mask on, but then who knows, once they get in their car, they could be taking the mask off. So, and just staying hopeful. I would say the morale has changed. Some of the staff are, scared. They are. And it's understandable to be scared because it's just unknown. You don't really know what to expect. So many people are walking around without symptoms. I have a brother who just tested positive. He found out yesterday, he's positive. And the only symptom he had was the loss of taste and smell. He didn't have a temperature. He didn't have a cough. He didn't have shortness of breath. So I think that's just the scary part of everything, not knowing if the person you sit next to actually does have it.
What can we do as, as a normal citizen, a regular citizen, to protect ourselves? What advice would you give a person like myself? Can I do anything to boost my immune system? Do I call the doctor if I feel, for example, different, inside my body parts? What should I do?
Well, you're a healthy person, so you eat very, very healthy. So I think whatever you're doing right now is good for us, like, making sure you take your vitamins, eating your fruits and vegetables. I think things to just look out for. I know a lot of people's primary care physicians are closed. They may have someone who you can reach out to just to kind of give you questions and answer type situations. So I know some primary care physicians have a nurse on staff that you can call if you have any symptoms, because everyone recommends that you not go to the emergency room if not needed. Okay. So it's a site. It's osfhealthcare.org. And it's a link that you can click on, and it says online coronavirus screening. And then you'll be able to do your own type of survey, a COVID-19 assessment, to see if you have any of those symptoms. And it kind of rates, the main thing that kind of separates, that stands out for this COVID-19 is the shortness of breath. Shortness of breath is the main indicator. Of course, you can have a number of things. But if you just have a new onset of shortness of breath and you are not asthmatic or have any lung disease, that's something that should be very, very alarming. So this link lets you know if it's something you should proceed to the emergency room or a testing site. But anytime you have some form, some form of shortness of breath, you should get medical attention, because that's nothing that you should sit in the house and self-quarantine.
What do you believe will be the new normal for the medical field?
The new medical field is pushing, because of this, more towards telehealth. I think we're doing that now, and I think it's going to be utilized more in the future. But it's only so much you can do with telehealth, so you still need to actually come in and get examined. I think it's going to be a while before we get used to shaking hands. I don't know how we're ever going to go back to that norm. We're in a practice where we give hugs, we hold babies when they come in after they've been delivered. So not being able to do that kind of takes away from, the interaction that we're used to. So it's kind of interesting to see where all this goes. I think a lot of patients and medical staff, we're still going to be in a sense of fear after all this is resolved. So,
what advice, as we conclude, because your daughter made an appearance in our video, final thoughts or advice that you would give to people like myself, or even people entering the medical field?
Well, you know, I entered into the medical field because I like to help people. You know, I'm a people person. So you kind of know what you're getting yourself into. I've been in the hospital on the med surge floor with critical ill patients. So this is a different setting, but at the end of the day, it's still you. When you became a nurse or any type of medical professional, you're here to serve, and it can be good or bad. It can be, you know, life threatening, and then that's in the situation we are now. So just being able to connect with our patients, either that is face to face or online, and just being just someone they can go to and just talk to, you know what I mean? And just to educate them, relieve some of their fears, whatever the case may be.
All right. Thank you, Georgette Brown. I appreciate that you're serving us and you're on the front lines, you know, keeping us healthy. Thank you so much. Please stay safe. Say hi to your daughter who's over there in the corner, and keep up the good work. Keep serving, keep protecting us, and we salute you all because you are our first responders and on the front lines. So I'm gonna let you get back to your daughter. Have a great day.
You as well. Thank you.